Health and welfare, official partners, our NGO partners, including insurance partner Oriental Insurance Company, teams from NSRLM, CSC, UTI CSLs, as well as Clairvoyance Tech, and our friends from the press who have joined us today to celebrate with us. May I now call upon Shri Amardeep Singh Bhatia to deliver the keynote speech.
Chairperson, Ms. Alongla Aier, technical consultant, and one of the key persons in the SHA team, Honorable Minister Shri Pangnyu Phom, Dr. Tika Kumar, another pillar of the State Health Authority, Dr. Vikato, Dr. Shrosi, Dr. Kubuno, and other friends from SHA, Directorate, and other departments. It's a great pleasure to be here for the third anniversary of the Ayushman Bharat Pradhan Mantri Arogya Yojana celebrations today. I apologize for coming late. Partly traffic, partly got stuck up in other engagement. I apologize for that. As all of you know, the PMJAY scheme was launched 3 years back by the Honorable Prime Minister Shri Narendra Modi in 2018, 23rd September. Ever since that time, this scheme has made great strides throughout the country and provided much needed support to, especially to the poor people of the country and also to the poor people of our state. Ever since the launch, this 23rd September and the period, the fortnight around this is celebrated as the Ayushman Bharat Pakhwada or the Ayushman Bharat Fortnight, and Nagaland also participates in this celebration, which is held throughout the country. We also send a representative to the celebrations or the observation of this day at the central level, but because of the pandemic we couldn't send anyone. This scheme has broadly two components. One is the health and wellness centers, which is implemented through the National Health Mission, where we are upgrading the sub-centers and the PHCs to provide greater number of services. The sub-centers to provide at least 16 diagnostic services, and we have higher skilled medical officer or person, the CHO, who is manning the sub-center. We have again a greater set of services which are being provided in the PHC, which is upgraded to health and wellness centers. And as per the feedback which we have been getting from various corners, not only the departmental feedback, but also from various other sources, the response has been good. The CHOs have been performing very well. In fact, I remember the Honorable Minister was also there in Mon. There was a report of the CHO at Pangsha providing services not only to our Nagas within Nagaland, but also to those who are staying beyond the boundary in Myanmar also, and very effectively. So that's one part of the scheme, which is the strengthening of the services through the various centers. And the second part is the insurance scheme, the health insurance scheme for the secondary and the tertiary care. The PHC and the sub-secondary takes care of the primary level, and the secondary and the tertiary care, where admissions are required, where inpatient admission is required, there the health insurance scheme is what is being provided through the Pradhan Mantri Arogya Yojana. As all of us know, whenever any hospitalization takes place, the out-of-pocket expenditure, the expenditure which a person makes for catering to that, catering to the hospitalization requirements, actually can eat away a lot of the savings of the person if he doesn't have any support system. And this actually has been, it is an established fact that many households are driven into poverty, driven below the poverty line because of hospitalization expenses. So these expenses, while these expenses, if they are not met through some risk pooling or government support scheme, it can have very adverse consequences for the family. And if you look at evidence throughout the world, you will look at Japan was one of the first countries where insurance was started. And look at the impact it has. The insurance, they have been able to establish a universal health insurance system in their health system. Through that, each and every person is provided health insurance. And look at the impact it has on their indicators. They are the longest living people in this world. The number of people who are having age beyond 100, the maximum number are in Japan. So it's very important that health insurance is provided to the people if we have to increase the coverage of health and reap the benefits of modern health for the people of the state and the country. And this scheme is actually, it has taken a lot of years, lot of experimentation before this RSBY was there, before this other attempts were made in the private sector also. This somehow we seem to be getting all the jigsaw pieces into the right place. We have the right IT infrastructure which has been put in place. We have the right treatment packages also which are coming in. All that is providing us the right ecosystem to ensure that health insurance is provided to the maximum people. This scheme per se provides health insurance to people who are whose social economic who are at the lower level in the social economic criteria. We use the HCCC census which was done long time back as a base, but the infrastructure which has been set up through this, many of the states are using this infrastructure to extend insurance cover to the other sectors of the population in keeping with the objective of having universal health coverage. So we also should, in the long term, in the days to come, strive to cover other sections of our population who are not covered under the AB-PMJAY through the infrastructure which is already set up. We already have 2.33 lakh families which are covered under the scheme. There are 98 hospitals and health centers. The hospitals are both in the private sector and the government sector. In the government sector, we have a great opportunity actually of providing. Government had already decided that the revenue generated through this scheme will be available to the health facilities for using at the local level, in the hospital level. So it's a great opportunity for the government hospitals also to upgrade their infrastructure and meet their local needs through the untied funds. We have 14 private hospitals, and there are 1,664 treatment procedures which are available under the scheme, which is actually a huge number of procedures. Services are cashless. Nobody is required to pay any cash while availing these services. As of now, we have issued 2.6 lakh e-cards. E-cards are the ones which are used for availing the services. Approximately 20,000 hospitalizations worth around 26 crores have been paid till now, and we hope that this coverage will increase. There are, however, many challenges which need to be addressed. Now, one of the challenges is increasing the enrollment. As I mentioned, there are 2.33 lakh families which are covered under this scheme, but we have not been able to issue cards to all the families. We made a number of attempts. We involved the district administration also in this enrollment, but there is a lot which needs to be done. We have also the agencies, enrollment agencies, which have helped us, but we need to do much more in increasing the coverage of e-card. We have only 41% coverage. We need to increase it to a much higher level. We have challenges in keeping the private hospitals on board. Private hospitals have been saying that the packages are not very remunerative to them. We hope that, but the packages are determined by the National Health Authority, and these are uniform across the country. We do not have much say in that, but hopefully we will be able to address these issues. But the private hospitals, especially in Dimapur, for example, CIHSR is doing extremely well. They are also able to attract people from neighboring Assam, which is very good actually. The more patient load we get, the better the hospital is. More experience the doctors get, more experience the patients, the doctors get, the hospital get, the better is the service which is provided. So in fact, we should be attracting more patients from the neighboring states to our colleges or to our hospitals. So CHSR is doing very well. We hope the others will also be able to push them to do well. We also hope that the district hospital will be able to attract more patients for providing indoor services under the scheme. There are some challenges with regard to fraudulent issue of cards, and some, not a very high percentage, but some incidents of fraudulent trial of benefits also through the private, some of the private hospitals. As of now, the team, even though the team is very small, we have a very small and very motivated and focused team. I must, in fact, thank all of them. They don't need any, they are self-driven, very motivated, and they are able to, led by Dr. Kika, Alongla, Dr. Sau, and others, they are able to drive most of the initiatives on their own. They have also taken sufficient steps to ensure that these frauds are nipped in the bud. And as of now, we are comfortable. We are keeping a watch, and hopefully this, in the days to come, should not be a big issue. We also are integrating with the Russian cards, which have been issued by the Food and Civil Supply Department, the data, ration card data, so that whatever deficiencies are there in the SCCC data, we are able to overcome that, and through that also increase or improve the coverage of e-cards, which hopefully we'll be able to do very soon. We are also integrating with the building and other construction workers who have a data from the RSBY scheme. We are also integrating with them, and hopefully that will also increase, help us in increasing the coverage. We are hopeful, as I said earlier, that we will use this platform to increase the health insurance coverage to the rest of the population also, including government servants in the days to come, and provide good packages, moving away from good packages mean that there are a lot of advantages in providing this health insurance coverage, because as per this scheme, once you are enrolled, you can avail services as per the treatment packages, not only in Nagaland, but anywhere in the country. And the country has, I do not have the number, but huge lot of private hospitals as well as government hospitals in Nagaland. So you have cashless service available anywhere in the country. So once we are able to get government servants on board also, we will be having a transparent process through which the government servants will be able to give services at all these hospitals. Hopefully, we will be able to work out a good package for them. There's a lot our Honorable Minister has to say also, so I will stop at that. Thank you for giving me the opportunity, and I hope the support from all of you will continue in making SHA a more robust and vibrant organization which will help in improving the universal health coverage in our state. Thank you.
Nilanam Golada Chipiasa. Mamla, Aishma, Government, officers, honorable ministers, is of this theatre. I mean, 2020 Aishma card going on me, philosophy 18 times is this inclusive. 8 times cumulative. Now in a Ayushman card per head, I mean, I'm not going to or Ayushman card per I mean, it's not good for Manukan. So, Bahakuru does it, and some motor yes. Or Ayushman department had assistance desert, or Nagaland government had assistance desert. Thank you.
Chairperson, Jadi Raja Ayushman Bharat Diwas program dipun pengajian saya sebelum Bhatia saya. Mulai last year ini mulakan 6 mulai waktu saya di Malaysia saya. Last year mulai ini waktu pengajian saya di workshop. Last year 2020 April 20 dia mulai acara jadi itu saya. Pisideng di dalamnya, tujuan di Malaysia, level seperti itu di dokter berbuat, apa ni operasi berbuat. Pulang mulai saya new tarik deh, mulai gina itu morning deh, next morning deh mulai level do picture saja. Itu pisideng, din pisideng tapi mulai cancer asal nak operasi. Mulai man tu kami nak pisideng, ini lah boleh. Dokter berapa? Ayushman Bharat Diwas ko play ko ang basta play ko na takawala kasi abi do Ayushman itu boleh na satu jada bisa along with tuber chunum tradisna apni nan asori moi khara bonna ase itu Ayushman Bharat Diwas ni thakile mulai to chabi ase abi itu government zindabad thakibo aru be tamosap dalina staff kan so Ayushman government zindabad na amar singuli pura katana pura. Thank you.
Everybody thinks I'm crazy, it's going around. This girl's headed for a heartbreak and she's going down. They say I'm always wanting something that I can't have. Baby, what about you? Everybody says you really have to go home. Tell the man that you love him, I don't really think that there's something I I'm calling out your name. I don't know if it's wrong, I don't know if it's right, but I'll follow my heart just the same. I don't really think I'm crazy for taking my time. I'm just looking for the answers I gotta find. They say it's gonna be a long, long ride. Baby, what about you? Sometimes late at night, when I'm listening and I'm calling out your name. I don't know if it's wrong, I don't know if it's right, but I'll follow my heart just the same. I don't really think I'm crazy for taking my time. I'm just looking for the answers I gotta find. They say it's gonna be a long, hard ride. Baby, what about you? 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 Baby, what about you?
Thank you for the time. First of all, I praise Almighty God for giving us opportunity to get together and to praise and together. Respected chairperson of this program, Ms. Alongla Aier, technical consultant, PwC, my most respected Resource Secretary, Sri Bhatia, IS, directors of Health and Family Welfare Department, respected Dr. Kika Longamer, Joint Director, State Program Officer of the Ayushman Bharat, and his dedicated team of officers, consultants, and staff, dignitaries, beneficiaries, press and media friends, ladies and gentlemen. It is an hour and a bright moment for all of us to celebrate third anniversary of Ayushman Bharat. AB-PMJAY. In this manner, our state, Nagaland, to a small state in the country, the first state to launch Ayushman Bharat on 23rd September 2018, along with the rest of the country. And fortunately today, AB-PMJAY is the largest public health insurance scheme in the world, which was launched by our Honorable Prime Minister. In Nagaland alone, it covers almost 2.33 lakhs households which is a great achievement within 3 years' time. That is almost 60% of the total population targeted in the state. Also, our state is the first state to implement health benefit package, which includes organ transplant, means kidney transplant packages, and it will be probably implemented from this year onwards. At present, there are 1,664 treatment procedures available under 26 specialists, which is widely availed by the needy people. The scheme has immensely helped beneficiary families from Nagaland who have availed the scheme's benefits either in Nagaland or in other states of the country. Since the introduction of this scheme, about 20,000 above population have been hospitalizations undertaken, and their expenses claimed by the beneficiaries worth around more than 25 crores have already been paid in our state to the beneficiaries. E-card has been issued to more than 2.6 lakhs individuals and reaching more than 96,000 households, which translates to 41% of the targeted families in the state. Way forward and challenges. We have lots of challenges and way forward to improve and to cover the remaining uncovered beneficiaries, targeted beneficiaries. It is a such blessing for all of us to know that, as our Principal Secretary has already mentioned, building and other construction workers registered under the Department of Labor will soon join the scheme, and accordingly, 8,584 new families will be added in the state. In addition, integration with National Food Security Act, that is under process, where the Aadhaar set ration cards will be linked to B-M-J-Y portal, and thereby ease the enrollment process and improve coverage in the entire state of Nagaland. With the partnering of the other departments, I hope and pray that this coverage will be improved. Our one plus point, and that the Nagaland State Rural Health Mission will be partnering with the State Health Agency, B-M-J-A-Y, to spread awareness about the scheme through self-help groups and also enrollment and e-card generation through the block data operators for more effectiveness and progress of the scheme. Now with the partnering with the Rural Department under the National Health Mission, and you are well aware, you have well organized the self-help group to almost all the villagers in the state. There we have some challenges. We all know that in our state, almost nearly 20 blocks have not been covered by the bank. So where there is no bank, even the insurance company and agencies also finding a problem. So with get more coverage, we need to improve the banking system, which state government need to be involved, and state government need to be approached to the bank authority. So government is always ready, government is always to go up to the grassroots level to the downtown level. So as a government, as a minister, wherever it is required, I'll be there with the department, with all the agencies. So please come forward and share with us so that together we can reach out up to the grassroots level and uncovered area. Ayushman is a new initiative. Upgrade our Ayushman is a new initiative to carry out enrollment drives in the villages to increase e-card generation. State Health Agency, BMJAY, along with various partner agencies, will be carrying out these outreach drives till March 2022. It is targeted to reach at least 70% of the total target families. So in this area, it's a great challenge for all of us. So with the partnering with the other department and other agencies, I hope and believe these targeted beneficiaries to cover it. I appeal to all of you to reach, to complete by 2022 March. In conclusion, I appreciate the State Health Agency led by our Principal Secretary, Health and Family Welfare, who is also the CEO of the PMJAY, for successful implementation of the scheme in the state till today. To our Principal Secretary, he is a very busy man, but he is a highly qualified and he knows. So he is under his leadership. Thus far, we got to lots of things and our beneficiaries as testimony given by two beneficiaries. I'm so grateful to all our officers and DMAC officers led by our Principal Secretary. I also think the insurance company partners, the Oriental Insurance Company Limited and the Paramount TBA for prompt and direct support in serving the people of Nagaland, particularly the deprived and vulnerable families, which are given health insurance cover through this scheme. I also think the common service centers, UTIIDSIL, Level Wens, Technologies Private Limited Nagaland, and various partner NGOs for participating and PMJAY e-card generation. I also thank the hospitals, both private and government, implementing this scheme, and particularly the private hospitals which are on board. Once again, I appeal to the private hospitals in Nagaland, which are yet to join on the board. There are very few private hospitals in Nagaland and public hospitals providing secondary and tertiary medical care. Also, very less. Therefore, I appeal to all private hospitals stakeholders to consider these as a social responsibilities to the people, to come on board and join the government and implement this scheme for the benefit of our poor people. As we strive towards the goal of universal health care through this Ayushman Bharat scheme, I wish Ayushman Bharat Bakwara or Ayushman Bharat fortnight and Ayushman Upkeep our initiative is success. I urge the community members to come forward and whoever are eligible for the scheme to meet their documents ready, that is Aadhaar and Ration card, to process their PMJAY e-card during this campaign, and they will benefit from this scheme. For your family as well as for your personal health. With this, thank you so much. May God bless you all.
Good evening to all of you. Respected chairperson of today's program, most respected Honorable Minister, Health and Family Welfare Nagaland, Sri Pangnyu Phom, our Principal Secretary, A.S. Bhatia, who is also our CEO, respected Director Health, Sir Bikato, Director Family Welfare, Sir Director Medical Education and Radio Safety, Madam Kopno, my friend Roland, CEO of NLTV, media friends, our insurance partner, our TPA partner, our other senior officers from the directorate, as well as from the NHK led by the managing director, and also other independent hospital representative who has come forward. And most importantly, the two beneficiaries who have, despite your health condition, you have come forward to grace this occasion. First of all, I would like to thank our Honorable Minister for sparing his busy schedule to grace this occasion. Sir, 3 years back in this state, on this day, though it was in the morning part, you have launched at NHK this program. And with that humble beginning, today we have come thus far. And I can proudly say that we have prevented impoverishment to the tune of about 26 crores to various beneficiaries. Otherwise, if this program was not there, if the scheme was not there, then the beneficiaries or these families could have spent that much amount from their own pockets. Who knows? Because of want of financial resources, many would not have gone to the hospital to avail the treatment. Many could have borrowed or sold or mortgaged their properties. So this is the intention of this program, that the out-of-pocket expenditure to be reduced, prevented, and through the access quality healthcare. So as we progress with your constant support to us, we hope that we will further improve and expand the program. I would also like to thank our Principal Secretary, who has been the mentor for the team, for guiding us and for giving us all the guidance, and anytime we walk into his room, he is available to guide the team. I would also like to thank, starting from our principal director, our mission director, our senior officers for always helping the small NHA team, SHA team. First, we have about 6-7 staff only running this the scheme. But with the support from the directorate and also from the NHM, we could get, roll the system smoothly. As our guest of honor, as well as our CEO has already spelled out, we are very, very hopeful that during this observance of the fortnight observance of the PMJ, with the partnership which we have just initiated with the NRLM, we hope that we will go and we will be able to reach to the uncovered places. So thank you NRLM for offering us the assistance. And I would also like to thank our media friends here who have been supporting the scheme, as well as the department, since especially during this COVID time. Since last year, they have been with us constantly. So thank you once again. And with this, I would like to conclude my vote of thanks. Thank you, sir.